Good evening, everyone. I am Batul from Clearnet. I would like to take a minute to introduce our platform Clearnet to everyone present here with us today. Clearnet is India's one of the largest digital live CME platform where doctors generate their medical content. I would like to welcome the organizer, patrons, and the speaker, along with that, the participant doctors in today's live webinar presented by Medusane INC, Indian Medical Association, Junior Doctors Network, Tamil Nadu Heddle, presents a workshop on Career Guidance Post MBBS Series 1 PLB exams. Team Clearnet is happy and proud to be the digital partner for this webinar. Now, without any further delay, I would like to welcome a very renowned personality, Dr. Venkatesh Karthikayan, sir, to please take over and proceed with the webinar. Sir, over to you.
Thank you so much, Batul. Very good evening, everyone. Myself, Dr. Venkatesh Karthikayan, MD Community and Family Medicine Postgraduate Resident from AIIMS, Patna. I'm glad to see that young doctors, more than 300 people, have joined from different parts of the country in today's webinar. In the past 1 year, IMA Junior Doctors Network have organized a series of webinars for the benefit of our young doctors. In the recent times, we have collaborated with Ministry of Health and Family Welfare, AIIMS Delhi, AIIMS Patna, IAPSM, KAHO, Star Health Insurance, Max Group of Hospitals, and with many leading national and international faculties. We got excellent feedback that our webinars are very useful for young doctors, and hence we are continuing this webinar series. As MBBS students and as junior doctors, we always wonder about the career opportunities in UK as a doctor. Though we are interested in exploring more about the PLAB route, many of us don't have a proper guidance. We do have several questions in mind, like how will be my life once I get to UK? How many years I should be there to get properly trained? Can I return back to India? How does the system work there? How much money it would cost? How much I would earn? So these are the various questions in the minds of young doctors. To answer all these questions, the Indian Medical Association Junior Doctors Network Tamil Nadu is organizing this webinar on the topic Career in UK, the Career Guidance Program. I would like to thank our speaker, Dr. Ganesh sir from Mizoram, for spending his precious time with us today. Welcome, sir. Our IMA JDN is Tamil Nadu is doing this career guidance series for the past 1 year under the guidance of Dr. Abul Hassan sir, who is a senior pediatric surgeon from Erode. Sir is the president-elect of IMA Tamil Nadu and the chairman of IMA MSN and JDN Tamil Nadu. Sir has been involved in various welfare activities for medical students and young doctors and has always been our motivating force. Thanks, sir, for being a great source of support to us. Now I request you to bless us with your welcome address. Over to you, sir. Sir, kindly unmute yourself, sir.
Thank you, Venkatesh. Good evening, all of you. Dr. Ganesh, Venkatesh, Raghu, and Clarinet, and all my delegates who have joined. IMA JDN is doing this wonderful work of, kind of helping our PG aspirants, the career aspirants, in a big way, continuously conducting these kind of seminars. This is very important in today's scenario, because, we are, India is producing large number of MBBS graduates, and the opportunities in India, are remaining static over the years. But, so naturally, the opportunities have become very, very highly competitive here. We have to look upon other avenues, other doors to open. One such thing is getting career in other countries, overseas countries like UK and US. Keeping this in mind, IMA JDN is, continuously conducting career guidance sessions, webinars, cracking PLABs and USMLEs and other competitive examinations. This is one of the important guidance and assistance we are giving to young doctors from IMA JDN platform. I'm very happy that our boys Venkatesh and Raghu have taken up this in a very serious manner. And also I thank Dr. Ganesh for accepting our offer and spending his valuable time with our delegates and help them to get their, kind of whatever goals they have in mind to be achieved through this seminar. I once again wish all the delegates who have joined here all the very best and wish them a very bright future. And I request Dr. Ganesh also to, in future also to join us in having this kind of webinars to help our younger generation of the country. Thank you very much for the opportunity. Over to you, Dr. Venkatesh.
Thank you so much, sir. As you always say, career guidance for young doctors is one of your main goals, and we are trying to work constantly towards it. I sincerely thank Ganesh sir for being a part of this initiative, and sir has also told that he is going to extend us his support in this career guidance series. Thank you so much, sir. Now I request the convener of MSN Tamil Nadu, Dr. Raghunandan, to give his opening remarks.
Good evening, sir, and good evening to all the delegates who are attending this session. Myself, Dr. Raghu, State Convener of IMA MSN Tamil Nadu and National Joint Sec Academics of IMA MSN. I sincerely thank Dr. Ganesh sir for joining with us today for this wonderful session on career guidance, and in specifically we are going to be discussing about the PLAB exams. As Venkatesh sir told, we are always working on the career guidance and especially foreign opportunities. And since medical students are largely graduated every year, we are focusing more on their opportunities post MBBS. That is the main goal of our guide as well as mentor, Dr. Abul Hasan sir too. We are trying to get a link with High Commission of England and also with the UK to have a collaboration for career opportunities for the Indian medical graduates, especially from Tamil Nadu, to get a job opportunity as well as to pursue their postgraduate in UK. And today we have Ganesh sir, who is Associate Professor of Department of Community Medicine from Zoram Medical College in Mizoram. Sir, as undergraduate from Raja Muttaya Medical College in Chidambaram, he has been working in the field of HIV and AIDS since 2006 in India. He has worked in the Tamil Nadu State AIDS Control Program as a STI medical officer, antiretroviral therapy medical officer in Madurai GH, and HIV Community Care Center medical officer. After his graduation, he completed his fellowship in HIV medicine, a course conducted in partnership with International Training and Education Center for Health from Government Hospital of Thoracic Medicine, Tambram, which is a center of excellence for HIV treatment. He has been selected as a best outgoing fellow and worked as a clinical trainer in International Training and Education Center for Health, India. Subsequently, he completed his MD Community Medicine from Sri Balaji Medical College and Hospital in Chennai. He has been the first person as a principal investigator to study about the discordant response to ART in patients enrolled in government program in India. Sir has been conferred with Bharat Vikas Award from Institute of Self-Reliance and Vocational Excellence Award from Rotary Club of Annanagar. The International Consortium of Clinical Research Excellence, Ethics and Education has provided a certificate of excellence in clinical research and in community medicine. BIVA Registration Scholarship Award was awarded to Dr. Ganesh sir for attending the second joint conference of British HIV Association with British Association for Sexual Health and HIV, Manchester in UK. Sir has published various research papers in national and international journals. His area of interest are discordant response to ART, virology, quality of life, clinical immunology, and public health. And he has also been working on various COVID-19 related publications as a corresponding author. Thank you, sir, for joining with us today. And now I request Ganesh, sir, to take over the session and guide our friends and students to achieve their PLAB exams. Thank you, sir.
Thank you, Raghu, for the introduction. So I hope the screen is visible.
Yes, sir. It is visible.
And it's in full screen mode.
Yes, sir.
Okay. So first of all, I'd like to thank the IMA and also the Students Association and also the Junior Doctors Association for inviting me for this workshop on Career Guidance Series 1. So we'll be discussing today regarding the PLAB. So first thing is we have so much of opportunity post MBBS. So we are planning to conduct on a monthly basis this period. So, but on this first series, we'll be discussing about the PLAB. So some of the options, like you can see for abroad or PLAB, US MLD, Australian MLD, even now these the Middle East countries have also come out with their own examinations, and they are also different. We call it a prometric exam. So the DHA is the Dubai Health Authority exam, and MOH, Ministry of Health. Then we have the HAAD, Health Authority of Abu Dhabi. Then we have the DHCC, Dubai Healthcare City Authority exam. Then the subsequent series, we will go on to MRCP, FRCS. Then what are the various masters available in abroad? There are certain masters you can directly pursue, like MPH and other fellowship courses. Then research-related careers in abroad. And of course, settling in India, we all know now the next is coming up, and it's in the initial stages. So we'll be getting to know enough details regarding next. And also in the coming series, we can discuss about the Union Public Service Commission exam and the State Service Commission exam, then Diploma in National Board, other fellowship courses in India, NGO-related careers, other research-related careers in India, and also about careers related to World Health Organizations and Center for Disease Control. And also there are other many miscellaneous courses for the MBBS graduate students. So today going on, we will be discussing about PLAB. So the first thing is, as a MBBS graduate student, you should have a very good clarity whether you want to settle in abroad or whether you want to settle in India. So be very clear in your thought process, and once decided, just stick on to it and start preparing for it from the day one. This is my humble request, and also this should be your first aim and motive. Now going on to the PLAB, like settlement in UK. So the full form of PLAB is Professional and Linguistic Assessment Board Test. We have given the website down below. So if you go into the website, you can get full details about everything. Okay. Then these are all the steps in PLAB. The first step is IELTS, giving the exam called IELTS or the OET. IELTS means International English Language Testing System or Occupational English Testing. Okay, both are nothing but they test your English language skills. Okay, see, previously during our days, only IELTS was accepted to appear for part PLAB 1, but now they allow both either IELTS or OET exam. OET exam they have started to allow from, I think, from February 2018. They are also accepting OET. So it is up to you to decide whether you want to go for IELTS examination or the OET examination. But there are saying that since we are from the medical background, nowadays they say we can go for the OET test because it is based on occupational English test. So some people say it is comparatively easy, but I am not supporting anything. I'm not supporting IELTS or OET. I leave it up to you. Whether you take IELTS or OET, it's up to you. But either one of the tests is mandatory to go to the next step. So the next step is PLAB Part 1. You clear PLAB 1, then you go for the PLAB Part 2. Then after clearing PLAB Part 2, you go to the GMC registration. GMC registration is nothing but General Medical Council registration. Say, for example, we have the NMC, the National Medical Council, previously called as the MCI. So once we pass, we register ourselves in the MCI. Like that, once you pass these 3 steps, you have to register yourself in the General Medical Council registration, which is the British Council registration for the medical healthcare workers. So now, the first step in preparation for the PLAB is IELTS or the OET, International English Language Testing System. So you need to know where to apply. So who are the people conducting these exams? So the first one is the British Council. So you have British Council in all major cities, and also the next organization that is conducting IELTS is the IDP Education Australia, and also the Cambridge Assessment of ESOL, English for Speakers of Other Languages. But as far as my knowledge is concerned, we have both the British Council and the IDP Education Australia. It's very much available in all major cities. So you can contact their office and you can book the test. And you can even book the test directly through online. Also, you can book these English language tests. Then the most important thing is, We have two modules in IELTS. One is the academic module. The other one is the general module. For PLAB, to appear for PLAB Part 1, they accept only the academic module. And another thing, this is the catchy point which you have to understand. The IELTS results are valid only for 2 years from the date of test. Please note down this. It is valid only for 2 years from the date of test you are appearing for the exam. After that, it becomes invalid. So the whole process of PLAB requires a lot of planning because this is valid only for 2 years. And the modules which are going to be tested for you people are the listening module, reading, writing, and speaking module. And the scores which you need to get to pass is overall you should get a score of 7.5 and individually 7 in all the individual modules. Once you get these scores and once you get these marks based on these certificates, you can apply for the PLAB test. So this is the IELTS test format. So I'm not going in depth into the details, but I'm just giving you an overview. So the listening has 40 questions and it has 30 minutes will be given for the listening approximately. You will be given some kind of conversations to listen and headphones will be given. And based on the conversations you are listening, questions will be given. And just to transfer your answer, an additional of 10 minutes will also be given. For reading also again 40 questions and the time allotted is 60 minutes. So for reading also paragraphs or any kind of essays or match the following, any kind of things will be given and then based on that they will be asking questions and then you have to fill it. And the time allotted is 60 minutes. Then writing 2 tasks. They give 2 tasks. They may ask you to write an essay on any topic to see that how is your grammar, how is your English language, how is your aptitude, everything they will test on it, and it is 60 minutes. And speaking is 3 parts. So once you enter inside, they will ask you to introduce yourself. Then there will be a lot which has some specific things for you to talk about. So you pick the lot. Then what topic comes to you, you have to talk on it. And after that, there will be a general discussion on that topic, or they will try to communicate with you to know how well you speak. And that is only 11 to 14 minutes or approximately 15 minutes. So this is the format for IELTS. Then going on to the OET, Occupational English Test, it's also a similar test. The only thing is, this is for the healthcare professionals. And when you apply for this, there's a category called medicine. So you apply, like you apply for IELTS in the academic module, apply for medicine category. So here also listening is 45 minutes, reading is 60 minutes, writing is given 45 minutes, speaking is 20 minutes. And the minimum grade required is B grade overall. I would like to tell you and give another suggestion. How much, however, you are an expert in English, even you have studied through English medium or Tamil medium or whatever it is, I strongly recommend you all to go for at least 1 or 2 months of coaching for the IELTS because it's very much needed, I feel. Without undergoing a coaching, don't directly go and take the exam. At least a 1 month coaching so that you will get a full in-depth view about how is the question paper is being set and what are the modules, how they are. So by virtue of practice, you get more practice and when you go for the exams, you feel easy. So just go for a 1 month coaching class or a 2 month coaching class. It might cost somewhere around 15,000 depending upon the coaching center, maybe 10 to 20,000 maybe the cost. I would strongly recommend to go for a coaching and then apply for the test. Then how to book the test? Once you got the results, once you're ready to fill the PLAB, you need to book through the GMC online account. Okay, you need to book through the GMC online account under my test category. See, this exam, the PLAB exam, what it covers is the common, important or acute conditions, those common in emergency departments seen by the trainees entering the second year of foundation program. And also, they want to know whether you are able to manage the long-term conditions seen in primary care setup. It's not very advanced things they won't be asking, but at least you should be able to understand the concept of handling the situation in the primary care setup. See, clearly I put in bold, it excludes the advanced duties of a general practitioner. So it excludes that. So next, coming to the blueprint, if you go into the GMC website, you can get the blueprint. But once this webinar is over, I can share the blueprint to all the participants. So we will share the blueprint through the email also. I request Raghu or any other person to take the responsibility. I can share it to Raghu and you can share the blueprint. Blueprint is nothing, it's like an exact guide to know what the exam covers. It's the kind of portion for your exam. It's a kind of curriculum for the PLAB. So that is there in GMC website. We can download it, so we can give it to you. It sets out the knowledge, skills, and behavior you are expected to demonstrate. Only if you know that, you can prepare for that. And all these topics and skills needed to pass are covered in the blueprint. So this is very, very important. It is kind of a portion. It is kind of a syllabus for us. So we will share the blueprint to you. Then coming on to PLAB Part 1. See, PLAB Part 1 is a written exam. It has 180 multiple choice questions, which you must answer within 3 hours. And each starts with a short scenario followed by a question. You need to choose the right answer. So mostly it is an MCQ multiple choice question. Only thing is, here they give 5 possible answers. From the 5 possible answers, you have to select the correct answer. Then some students might be thinking, what is the maximum number of attempts being allowed for the PLAB? See, the maximum number of attempts you are being allowed either for PLAB 1 or PLAB 2 is 4 failed attempts. See, but you have an option of appearing even after 4 an additional attempt. But the criteria is there must be at least 12 months between your 4th failed attempt and requesting for an additional attempt. And in between, during that time, you should have undertaken further learning to improve your medical knowledge and clinical skills. You must have completed at least 12 months of clinical practice, or you must have completed a postgraduate qualification. This I am telling you, if you have failed PLAB Part 1 or Part 2 after 4 attempts, you want to again appear, you should produce this certificate of 12 months clinical practice, or you should have done the postgraduate qualification. If you have already had more than 4 failed attempts at either Part 1 PLAB or Part 2, you are no longer eligible to take the test or apply for any additional attempt. But don't think about it. I want our students, all of our students, to pass PLAB in first attempt or at least in second attempt. Please don't ever think about going to more attempts. That's not a good thing, because it also involves a lot of costs every time when you are appearing for the PLAB. And if you are granted an additional attempt at PLAB 1, you may need to submit a valid English language evidence for verification. So this is the problem. Once you have failed 4 times, and by the time the 2 years would have been lapsed, and then again you have to start from the scratch. You have to again go to the English language testing system exam, then appear for Part 1, then appear for Part 2. So that is the reason from the time of slotting of your language system to the appearance of the PLAB 1 and Part 2, you should have a well planned, and your planning should be very perfect. So I'm just sharing one model question. So this also, I took it from the GMC website. An 89-year-old man has a basal cell carcinoma on his forehead, which requires excision. He has dementia. So because naturally he's 89 years old, he has dementia. The clinical nurse feels he is not competent to give consent for surgery. So which is the most appropriate action for obtaining consent? So they give this 5 options. Ask a psychiatrist to assess his cognitive function. Ask his general practitioner to sign the consent form. Ask his wife to sign the consent form. Or ask the patient to sign the consent form. Or ask the surgeon to assess his mental capacity. See, the reason why I have taken this question is, I could have taken a totally a clinical oriented question, which you all feel maybe very comfortable. But the reason I selected this question is, you should understand one of the main components of the PLAB blueprint and the curriculum is they also want you to know and understand about the ethical concerns in UK, because some of the portions of the question will be dealing with the ethical concerns. So that is the reason I have selected this question. So if you can clearly see this question, it has an ethical component also involved. Okay, so that's the reason. It's not only about totally about clinic, not only about medicine, surgery, OG, community medicine, pediatrics like that. There will be also component about the ethics, what is the practice being done in United Kingdom, you should be aware. Again, another part one model question. This is also a very major ethical question. See, I will go through the question. A 14-year-old girl attends the GP, general practice surgery, requesting the oral contraceptive pill. She is a sexually active person and her boyfriend is in the year above her at her school. Her parents are unaware of the appointment and a request for the oral contraceptive pill, which is the most appropriate management. Advise her about safe sex and prescribe OCP, contact her parents, contact the local safeguarding team, or contact the police, or explain it is illegal to prescribe OCP for her at this stage. See, this question, you have to understand what is the legal age for a girl to have a consensual sex. So this question also I am putting it, there can be these kind of questions will also be in the exam, so that you have to have a very strong clarity about the ethical, medical ethical guidelines that is being followed in United Kingdom. So now going on to part two. You part one, now we are preparing for part two. See, part one, PLAB exam you can take in India itself. We have many centers. You can take in Chennai, Bangalore, Hyderabad, major cities like Mumbai, Kolkata. There are many major cities. If you go through the GMC website, their email with phone numbers, everything is given there. All major cities you can take part one. But for part two, you have to go to UK. See, PLAB part two is mainly OSCE. Now, OSCE is no longer new for our Indian medical graduates because of the CBME, competency-based medical education. We are now following OSCE in almost in all medical colleges. Objective structured clinical examination. So, PLAB part two, it is made of 16 scenarios, and each lasting for 8 minutes or maybe 8 to 10 minutes. Okay. And aim to reflect real life settings, including a mock consultation. So mock consultation means may not be a real consultation. They give you a scenario and then they will ask you to perform and they will just observe how are you performing. So understanding your test results. See, they group the skill areas under 3 main headings or domains. First thing is how are you applying your knowledge and experiences regarding the clinical practice. Next thing is the assessment regarding the good clinical care. Then how are you going to manage and what is your clinical care management? And the pass mark is, you have to understand the pass mark for PLAB part 1 or part 2. It's like not about 30% or 40% or 50% or 60%. It is not like that. It's not in percentage. It has an internationally recognized method called as Angoff method, okay, and include one standard error of measurement. So my understanding is the result for the PLAB varies from individual group to group. Okay, say for example, in your group, what is the minimum mark score and what is the maximum mark score, and based on this, they may have the Angoff method and they may get they will give you one score, below which you are failed, and 1 mark for 1 correct answer. If you feel your marks have been undermarked, say for example, you're not satisfied with the marks what you get, you can apply for appealing within 10 days of your result. Okay, within 10 days of your result, you can apply to the GMC, you can go for a re-evaluation. Then what will your scenario look like? Just a minute. For PLAB part 2. So we are telling about the mock consultation. So there will be 16 stations. You'll be given patients, and I'm just explaining one scenario. So here is a patient who is coming to you with a pain in the head. He is Mr. James Horton, 45 years old. He has called for complaint of pain in his head. You are not given any other information. You must assess and manage the patient over the telephone, or you might assess him directly also. You will be given 8 minutes to complete the scenario. What will the examiner be looking for? You have to know this. The examiner wants to see you demonstrating the behaviors that we expect of a doctor. They will mark you against 3 domains. Again, how you gather the data, the technical and assessment skills, and what are the clinical management skills you are following, and interpersonal skills. So then what will you need to demonstrate to pass? See, the first thing is when a patient coming to you with headache, say they want to know whether you take the appropriate history, like what are the aggravating factors, relieving factors, where is the headache, it's a frontal or occipital, or what is the location, what is the duration, number of days, and what are the triggering factors, relieving factors, whether you are asking them. And taking a medical history of, is he taking any medication that is aggravating headache, or did he have any recent trauma? And what is his lifestyle, like alcohol, diet, his sexual habits, his sleep pattern, and identify patient's concern, listen appropriately, and display empathy. See, this is the most important thing which you have to understand. This is actually nowadays started to becoming lagging nowadays, this empathy. We not only in India, everywhere we see the empathy is coming down. So we have to emphasize nicely on this empathy. Empathy means like understanding the patient's feeling from his perspective. A person coming to you with a very throbbing headache, you have to understand his pain. So you have to empathize that. So they also see that whether you are empathizing that. So that component is also analyzed when you are having the conversation. So then finally you come to the diagnosis. Probably you can give a diagnosis, of migraine, or if not possible, you can at least give a probable provisional diagnosis. You may say, I may go for further investigation depending upon the case, and recommend appropriate management and how fluently you are conducting and how professionally you are dealing with the patient. Then these are some of the resource materials. These are the websites which I found. It has 3,400 plus question banks, and you can download the blueprint from the below link. And I strongly recommend all of you to buy this Oxford Handbook of Clinical Medicine and also Oxford Handbook of Clinical Specialty. Okay. So the most important thing we are now coming is the cost involved. Okay, the cost involved. See, for IELTS, the cost is 15,500. I already told you can go for IELTS or OET. IELTS somewhere around 15,500. For OET, it is somewhere around 30 to 33,000 approximate INR. And the cost for PLAB Part 1 is 23,687 approximate INR. And for PLAB Part 2, it's 86,840. This is effective from 1st April 2022. Then the travel expenses to UK for PLAB Part 2 and accommodation. See, this I cannot tell because it depends upon the time of you booking the flight ticket, your comfort zone, whether you want to fly in economy class or whether you want to fly in a business class, and what kind of accommodation you want to have. I strongly recommend that you have a friend or a relative so that you get the accommodation free there and you book the ticket well in advance so that the costing can be reduced. So then after passing PLAB 1, PLAB 2, you have to go for the GMC registration. There are 2 registrations. One is the registration fee for the newly qualified doctors. Actually, they give some concessions. Say, for example, the application for provisional registration is coming around somewhere around 5,000. And the application for full registration for the newly qualified for license to practice is around 15,431. If you are not a newly qualified doctor, the standard fee to join the GMC for registration is somewhere around 420 pounds, which comes around 40,257. Even if you want to go to UK license to practice for a temporary period for visiting as an eminent specialist also you have to pay. So now you have to understand who gets the discounted fee. So as of 1st April 2018, the person who gets the discounted application fee applies to doctors who hold or have previously held provisional registration, and for doctors who submit their application within 5 years of passing the primary medical education. So that is the definition for newly qualified doctors, and do not hold or have not previously held provisional registration. So this is the discounted fee cover, and it only covers your first full year of registration. Then after that, you have to go for the standard medical registration fee. So these are all the references which I got from the GMC. I thank you all very much, and I thank the IMA, I thank the Junior Doctors Network. Going in my younger days, I did not get any kind of guidances like this. And generally, the biggest mistake we all do is after passing MBBS during the CRRI period, we all feel that's the period to enjoy. Life is, yeah, of course, you have to have a balance between the enjoyment and also between the studies. So during CRRI, yes, you can have fun, you can enjoy, but at the same time, you have to start preparing for the exam. So from my experience, I would say, once you finish this PAS form and micro, you start preparing for the MCQs. And by the time you finish, you would have been ready for the MCQs for 2 years. And then you can, after the CRI is over, you can go for the IELTS, and then you can go for the PLAB part 1 and part 2. My understanding is if you are really good and if you are really hardworking, you will land up and reach UK within 1.5 years. So my ambition in life during those days was to settle down in UK, but due to certain reasons, it did not happen. But at least because of this presentation and because of this small guidance which I have researched and I have presented to you, if at least few students out of this presentation go to UK and settle down in UK and you all become a great doctor and serve there, and if you are happy, I am very happy. And this is my mobile number. For any other future guidance, you can contact me, and also you can note down the website which is given down. Thank you so much.
Thank you, sir. If any audience has any question to be posted, please kindly put in the chat box so that sir can answer.
Somebody
Meanwhile,
is posting wonderful session. I don't know who is it. Oh, okay. Again, okay. English sir has posted.
So meanwhile, I'll just deliver the vote of thanks so that if you have any queries or if you have any doubts, kindly put in the chat box.
Can I stop sharing the screen, Raghu?
Yes, sir.
Just a second. Batul, are you there?
Yes, I'm there. I'm there.
Please let us know if there are any questions coming up in the chat box.
Sir, I'm checking with that only. As of now, we haven't received any questions. Just a second. Give me a
And
moment.
Raghu, actually, I have a doubt. See, this participant shows tier 5. So they have a separate list of the participants.
Yes, sir. Yes, sir. Yes, sir. It will be through a separate window.
So do you have any idea how many participants have joined today?
I'll just inform you at the end of the session, sir.
Okay, okay. So any comments from your side regarding the session? Dr. Abdul sir, Venkatesh sir, what do you feel?
So I have been listening to your session for the past 30 minutes. It's been very crisp, and you have given what is most needed. Okay. So even I'd like to share my experience where at my time I was more interested in giving PLAB exam. Yeah. And at the time I found it extremely difficult to deal with IELTS, especially in the writing part. So then only we got this OET as a new trend and things follow. But
now you can go for OET also.
Yes, sir, yes, sir. But by the time we got struck by COVID pandemic and everything changed. Okay. So your session, like if like your session would be very much useful. At least people get to know that okay, where can we get the further details? So you have shared the link of GMC, and you have shared few useful resources also. Yes, I think all this will be of a very great help to our students, sir. Thank you so much.
Thank you so much, sir.
I think Dr. Abdul Hasan sir is there.
Thank you, Dr. Ganesh. It was a really wonderful presentation. You really simplified many of the tough areas. I think definitely your talk might have enthused many people to, kind of think about taking this career. I think, in future, I think there will be a lot of more and more people would like to come for this taking PLAB, because as I said in the beginning, we will have to give them more options now. Otherwise, people will get frustration. Even in the studying medicine during MBBS time itself, if they get to know all these options available after MBBS, the kind of pessimism will not be there. They will be very optimistic, and also they will start focusing in the beginning itself. Settling in UK, cracking PLAB is one of the best option outside India. I can say that.
Yeah.
And definitely we should promote this, and otherwise there will be a lot of you will one day we will hear that unemployment for doctors in India. So that scenario is fast approaching. So we will have to take this much.
And
So,
my one more kind request, sir. I know you have been doing this for a long time.
yeah.
So I would like to collaborate with you people, like bring in more experts, and we would like to
Yes,
continue
yes.
the series like
Yes,
US and
yes.
MD.
Yeah,
Maybe
yeah.
even foreign speakers. I can bring some foreign speakers also if
Yeah,
interested,
yeah.
and we can share about real kind of experiences. This was only a overview, so that we
Yes,
can
yes.
elaborate on it. We can elaborate on it. So we will think about it later.
Yes,
But
yes.
thank you so much, sir, for the
We will
opportunity.
expand, definitely will expand our
Definitely,
activities.
sir.
Thank you,
Sure,
sir.
sir. Thank you so much, sir. And we have received many questions in the chat box.
Yeah.
Dr. Suranya has asked, FMGs can directly apply for PLAB without having Indian license, or is it necessary to clear foreign medical graduate exam?
FMG means what she really means.
Like studied from a foreign medical college, and they are writing exam in India to clear to get license from India, right? So if they really wanted to get the license from India to pursue to write PLAB exam, or they can directly write PLAB exam after graduating from foreign medical colleges.
This is a very, very difficult question. See, now, recently, the Indian government guidelines are they're just framing some guidelines. They're telling even from any country you're graduating, you have to clear this exam. But it also depends upon in which country they have done that FMG. Okay. So if they have done that in a country which is being it's been recognized by the GMC, they can directly go for it. If the exam which they are doing is directly recognized, they can directly go for the PLAB. But if it is not recognized, if they say it has to be recognized through the Indian government, then they have to come through the Indian government and clear it and then go. So this is my understanding.
Okay, sir. Dr. Shakti Kumaraswamy asked whether age criteria is there for PLAB exams.
There is no age criteria for PLAB exam. Even a 45 or 50 years old guy in UK is still considered as an young person. That is the biggest advantage. At any age, you can go. But the only thing is, it's better you start early, because the residency program, you have to climb up the ladder. If you're very old and you are already doing very well here, after PLAB, because how much they recognize our Indian degree and experience is a big question, so that you will be placed in the basic level, like a residency program. So that might be difficult for them. So it is always better to start early, but we are also planning to have a next session called as the GP, General Practitioner session, wherein which you don't need to write the PLAB exam. Directly, based on your experiences and degree, you can directly write the GP exam. There is a bridge course is there. So that we will discuss in the next workshop.
Thank you, sir. And Dr. Dev has asked, is it better to apply for PLAB exam after PG or before PG?
It's all depends. See, I say, if you're going to want to go to UK so early, you can apply before PG also, because your PG degree is not recognized there. So rather you directly finish up and do and just apply for the PLAB, go there and do the MRCP or FRCS or any other PG, maybe in diabetes or something in OG, whatever you want, you work there and then you go for it. Or else if you are preparing for these exams and you are studying here for 3 years, 4 years, you are again wasting because your degree here is not recognized there. Again, you are going to go only from the thing. But another one good thing happening now is, even without PLAB also, nowadays you can directly apply for MRCP, and MRCP examination centers are directly now available in India. You also have to understand, you can do the Indian post-graduation degree, simultaneously you can do the MRCP also without appearing for PLAB also. That option is also there.
Okay.
PLAB is the one option. There is an option for GP. You can have an option for direct MRCP also. But only thing is in MRCP, if you write in India bracket, they will put MRCP India, IND. If you are getting the degree from UK, they will put MRCP UK. That will be the difference.
Okay.
And other Abu Dhabi and other UAEs.
Okay.
Any
So
other question?
this PLAB exam
Is
is
that clear?
only applicable in UK, or is it applicable in even Canada and other countries, sir?
I think PLAB exam is basically applicable in UK and US. They have a separate exam, USMLE, and Australia they have a separate exam. But if you have cleared PLAB or MRCP, the Middle East countries are accepting.
Okay. So and another question
Countries are
is,
applying, accepting.
okay. Firstly, there was very informative session. Thank you. I actually want to ask that if my CV is not so great, or if I haven't done many research, but I did my postgraduate from good college, whether I have a chance to get interviews after PLAB 2.
Yes, sir. The question to be answered is, see, it also involves a little bit of luck, always in life. But the thing is, if you're not trying, you're not trying. If you're writing an exam, there are two options. You pass, you fail. If you don't write the exam, you fail. So like that, okay, even if you don't have a strong research background also, but you will be having some clinical experience background. But if you are really young, if you're not very old, maybe like 30 or even in your 35, I would say if you want to go and work there, you can appear for PLAB or you can directly appear for MRCP and you can go there and work. They may not be seeing much into your research thing unless until it is a totally research-based career. Because what I mean to say now is, because of the COVID pandemic, and also people are expecting more and more pandemic in future, they need lot of general practitioners also. They need lot of doctors now. So it's not only about research. They need huge manpower. Throughout the world, huge manpower. And we have lost so many lives in COVID pandemic, especially doctors' lives. So there is nothing harm in trying, even without a research background also. You see, nowhere in the PLAB, there is no mark for the research background. You see, it's IELTS part 1 and part 2. But of course, when there is two people coming together with the same mark and if the competition is so heavy, then they might look into your research component. But passing is one thing, getting a residency program is another thing. It also involves a little bit of hard work, applying into so many organizations, staying there for some time and trying your luck. It's the same thing. Not all neurosurgeons become a great neurosurgeon. Not all cardiologists become a great. Not all gold medalists shine very well in life. It's all something like that. It's just we have to take the risk. We don't know what happens.
Okay. Thank you, sir. And here we have Dr. Surya asking, after I complete my GMC registration, what is the next step? Can I straight away join my PG or should I work there before for a few years before I'm eligible to join a PG course?
No. Yeah, you have to join the residency. After PLAB 2, you have to do the registration. Then there is some kind of traineeship will be there. That will be the residency program. Only after that you will go for it.
Is there any tuition fees to do the PLAB 2 exam or other things in the upcoming years, sir?
The tuition fees, in the sense I told now already, for part 2, the fees is around 89,000 you have to pay.
Okay.
But I'm not
Sir,
exactly sure if there any institution is really training in India. That part I'm not exactly sure.
Okay. So post PG, can we join directly FRCS, or we have to again go with the MRCAP or MRCS and then we have to go for a fellowship?
FRCS and MRCP are two different things, okay? MRCP is member of Royal College of Physicians. FRCS is fellow of Royal College of Surgery. And for you to apply, I think you have to have some basic 2 to 3 years of working experience. That certificate is needed. Based on that, without PLAB also, you can directly apply from India.
Okay.
But now through PLAB also, after going there also, you can apply.
Okay, okay, so thank you. And then what is the basic salary for doctors after completing their PLAB exam and joining residency there? Dr. Shaikh Ahmed.
See, I have not looked into it, but it's just maybe a wild guess. I would say it will not be maybe less than 2 lakhs Indian rupees, not less than that, 2 to 2.5, 2.25, something like that. I'm not exactly sure about it.
Okay, sir.
I need to ask my friends over there in UK. 25 of my college mates are settled in UK. I need to ask them. If you want, I can ask and I can reply the question.
Sure, sir.
But I feel it should be around somewhere around 2 lakhs. And one good thing is, while doing the PG itself, you will be earning so much.
Okay.
The biggest cost is finding a place to live in UK. I have been in UK for 15 days. I went for this British HIV Association conference. One of the biggest challenge for me was the accommodation. But the food and everything you can bring, you can cook, you can manage. But the accommodation is the biggest thing. And where you have the accommodation also matters. Whether it's in central London or it is in Brighton, Sussex, or which location also matters. And accommodation is the main thing. But of course, you have the youth hostels, everything you can manage for a few. But that costing is really the one which you have to bear in mind. Of course, you should need to have some good background to search job for a few months till you get a job. There is no guarantee you finish the PLAB immediately you may not get a residency. You have to wait. It's similar like us only now. Immediately you finish, there is no guarantee. Immediately you finish your PG, there is no guarantee. I finish MD community medicine means there is no guarantee I will get a job. I have to apply for so many institutions. I have to prove myself, then only you will get a job. It's all the same everywhere.
Thank you, sir. And finally, we have one enthusiastic first year medical student who want to ask how to start my preparation from the first year and study all the 3 subjects in correlation with this PLAB exams.
Okay. To that first year, my answer is, see, you just now concentrate in your first year examination. But now, fortunately, we have this competency-based medical education has been started very well in India. And we also have something called as early clinical exposure. Can you ask him he is from which college? I hope in his college, the early clinical exposure is being conducted. If the early clinical exposure is being conducted, it makes things easy for him because simultaneously, they will have a theory in anatomy. They will also show a case of breast cancer. They will also show how breast cancer will be in the radiological finding. So we do a horizontal and vertical integration is being done. So when they get that level of exposure because of the competency-based medical education, I feel from first year onwards, they will try to get a better understanding about the clinical subjects also. But I strongly say, my advice, this is my advice only, it's my personal advice, you first finish off your anat physio biochem because that is the toughest part and the toughest portion. Once you finish off that, then you start simultaneously start working on the PLAB MCQs. Every year you start doing some 500, 1000 MCQs like that. By the time you reach the final year, you will become expert and then it will be easy for you once you finish the CRRI. That is my thing. So always give more importance to anatomy, physio and biochem And because of CVME, it might be easy for him, but concentrate more in the first year. I would say after PATH, when they finish somewhere near PATH Form Micro, then they can start completely entering into the preparation of Part 1 MCQs. This is my opinion. I may not be right. It differs from person to person, and it also differs from individual person's perception, capability, knowledge, hardworking skills. It involves a lot of things. So which I don't know about him. I cannot directly guide him without knowing all these things about him.
Yes, sir. Thank you. And last but not the least, there is a question that like the last one, we have MBBS graduates from the foreign medical colleges. They have to write FMG and only practice in India. Similarly, is there any anything, any criteria once they complete their post graduation from the foreign medical college and come back?
I'm not exactly sure. I need to verify that. Still, I don't have a better clarity about that, because this is only an overview about the PLAB. To that level, I didn't think. Sorry, I cannot answer. I cannot answer the question which I don't know.
Okay, sir. Sure. I guess all the remaining questions we can just answer in the upcoming next sessions.
Not
And
only that, my number is being shared. You can share. They can call me directly. They can WhatsApp me. I can. And one more thing, I'll share the blueprint that gives the full portion for the PLAB, so that can also be mailed to everyone, so that they feel more comfortable in looking at it. I'll share it by WhatsApp. You can immediately, while you are sending the e-certificate, you can share the blueprint to them, so that they will know the full curriculum, the portion.
sure, sir. Thank you, sir.
Okay.
And on behalf of Medusane, IMA Junior Doctors Network, Medical Students Network, and HEDAL, I would like to thank Dr. Abul Hasan, sir, President-elect IMA TNSB and Chairman of IMA Junior Doctors Network and Medical Students Network, Tamil Nadu, for joining with us today and motivating and guiding the students who have joined this meeting. And I would like to thank our today's speaker, Dr. Ganesh, sir, who has given an excellent guidance on the PLAB exams and also the career opportunities they have post MBBS. I would like to request him for continuing the sessions in future days, and also to bring more and more useful sessions for the undergraduates and also for the junior doctors. And I would like to thank Dr. Manigandan Mogadnas, sir, State Convener of IMA Junior Doctors Network, Tamil Nadu, and Dr. Venkatesh Karthikeyan, sir, General Secretary of IMA Junior Doctors Network, Tamil Nadu. Last but not the least, I would like to thank Clarinet, who have been a great support for the technical purposes. Thank you so much, ma'am. And I would like to thank all the audience who have joined today. I request you all to keep a close eye on all the sessions which we are conducting in the future too, and join them and get benefited. Thank you so much.
Before
Thank you,
concluding,
Doctor.
I would also like to thank each one of you present here. Team Clarinet is happy and proud to be the digital partner for this session, and Team Clarinet will be looking forward for such more sessions from your end as well. Thank you so much.